according to the June 27th report from the Department of Public Health and Human Services. Scientific evidence indicates that the Delta variant is more contagious than the other COVID-19 variants that have previously circulated in the United States. Importantly, and sadly, more children and young adults are getting seriously ill with the Delta variant. The dramatic effects of this Delta variant has prompted the Centers for Disease Control and Prevention to recommend more precautions, such as everyone over the age of 2 wearing masks indoors in public places where the virus poses high or substantial risk of community transmission. The CDC currently lists Yellowstone County as having high COVID-19 transmission based on our case numbers, our positive test rate, and our low vaccination rate. You heard me say many times in the past that we were experiencing a rapidly changing situation, and that still holds true today. Just yesterday, Yellowstone County was shown as substantial risk, so things are clearly getting worse in our community. As of Monday this week, Riverstone Health has changed our policy to be more consistent with CDC guidance in response to the evolving situation. And this, again, is particularly related to the spread of the Delta variant. We are holding most meetings by Zoom and requiring that staff and visitors, regardless of vaccination status, wear masks in our buildings. For the past 2 months, masks were optional in non-clinical areas for fully vaccinated people. Masks have been required in clinical areas all along per CDC guidance. I want to talk a little bit about the vaccines. The Pfizer, Moderna, and Johnson & Johnson vaccines all work against the Delta variant. New data show that a very small percentage of vaccinated people can get Delta and may be contagious, but these cases represent a tiny fraction of the transmission occurring around the country. Within Yellowstone County, to date, more than 1,300 of our residents have been hospitalized with COVID-19 illness since the pandemic began last year. Only 17 of those folks, just 1.3% of hospitalized patients, were fully vaccinated. Among the 285 Yellowstone County residents who have died from COVID-19 illness, only 4, or 1.4%, had been fully vaccinated. 3 of those 4 were people older than 80, and the younger victim had a pre-existing condition that compromised their immune system. To reiterate, the vaccines work. Since the pandemic arrived in Yellowstone County some 17 months ago, 98.7% of hospitalized COVID-19 patients and 98.6% of the people who have died of COVID-19 were unvaccinated. Hand washing, social distancing, and wearing masks are important measures we can each take to reduce the risk of spreading COVID-19 within our community. Vaccination helps reduce the virus spread, and it is the only preventive measure that helps make the disease less severe if a person does get infected. Last summer, when no vaccine was available, COVID-19 sickened and killed dozens of people living or working in nursing homes and assisted living facilities in Yellowstone County. Let's not forget that 24 Yellowstone County people residing in senior care facilities died of COVID-19 in July 2020 alone, some of the darkest and most difficult days we have faced. Since December, vaccines have been offered to all residents and staff at these care facilities. With vaccination, COVID-19 cases and deaths have decreased dramatically. Recently, though, the COVID-19 activity in local elder care facilities has been limited to just single cases. I want to applaud and thank our local senior care facilities for their hard work to protect their residents and their staff. I'd now like to turn the podium over to Dr. Bush. He will talk about the situation at hospitals, and then Dr. Koo will talk more about the Delta variant. After both of them speak, we'll take questions before wrapping up. Dr. Bush.
Thank you, John. Appreciate the introduction. I am Michael Bush. I'm the Chief Medical Officer at St. Vincent Healthcare. And I really wanted to say thank you for this chance to address you and talk about where we're at with COVID and the illness that we are seeing. I was talking to one of our leaders at the hospital this morning, and I thought her quote was very poignant in that she was expressing that she was tired and done with COVID. But the COVID virus isn't done with us. And that's the key factor that I think we're dealing with. As we look at this Delta variant, as John said, we do know that it's more infective. It doesn't cause more severe illness, which we thought initially months ago, but it is more infective than what we have been seeing. We also know that the vaccines are still protective for COVID and that there is good protection still for preventing serious illness. Our own data at St. Vincent's shows that since the 1st of June, we've admitted 89 patients with COVID. Only 10 of those patients have been vaccinated patients. So even given the preponderance of vaccination in our community, we still know that the likelihood of being admitted to the hospital, getting sick enough to be admitted to the hospital, exists if you're not vaccinated and is greatly reduced if you are vaccinated. And then those 10 patients were ones that had immunocompromise of some reason and greater degree of comorbidities as you looked at them. As we looked at the amount of time that these patients have spent in our hospital, the average time for the unvaccinated patient was edging toward 9 days for sorry, I'm not sure whose microphone that was that fell. But is edging toward 9 days. For the vaccinated patients, it's really at 4 days we're seeing for their length of stay or time in the hospital. As we look at how we're prepared for this, currently today we have 16 patients in the hospital at St. Vincent's for COVID, but we're anticipating over the next month that that number is going to double. And we are looking at where the staffing is. You know, we've experienced the same thing as the Billings Clinic, which is very high volumes and capacity over the summer with all the trauma and other things that we see, other illness and things that have been put off through the coronavirus epidemic. And we are seeing staffing, and we're now competing for that staffing with the whole rest of the country that's experiencing this. And so we have concerns about, you know, trying to manage this on a day-to-day basis. Our testing capacity and our PPE, personal protective equipment for our providers, staff, nurses, is all very adequate, so we're doing well there. And then the final thing I would like to hit on is that, again, we do know that we can control this virus. Wearing masks, social distancing, and being vaccinated are the things that we can do that will make a significant difference in how we spread this virus in the community. And on a personal level, my wife and I have started masking when we go out of the house starting this week. And so, again, at this point, I would like to turn it over to Dr. Neil Koo, who is an infectious disease physician and expert from the Billings Clinic. So, Neil?
Thank you very much for the introduction, Dr. Bush. So my name is Neil Koo. I'm an infectious disease trained physician and serve as the hospital and healthcare epidemiologist at the Billings Clinic. I'd like to take this little opportunity to kind of talk about this, the B16172 variant, or commonly known as the Delta variant. This is, as John has mentioned, this has become the predominant variant that's in fact causing infections of COVID-19 in the U.S. and as well as in Montana. What makes this variant distinctly different from other variants, and this is what makes this very unique and why this situation is much more dire than previous variants, is that this is not your run-of-the-mill garden variety variant. It has, one is that it has enhanced ACE2 receptor binding. And what that means is that it has enhanced ability to infect cells. Therefore, less virus is needed to cause infection. Those who are infected with this virus and become symptomatic have found to have increased viral loads, and therefore resulting in increased amount of viruses that's being shedded. That translate into that more viruses are available to spread to cause further infections. Just to give you an example, comparing to other variants, the original Wuhan or D615G variant had a R0, or secondary infection rate, of about 2.5. So for every one person that has an infection, it potentially can infect 2.5 others. The Alpha variant, when compared to the Alpha variant, for every person infected with that variant, potentially can infect 4 to 5 other people. And then with the Delta variant, one infected person can potentially infect 5 to 8. So there's a significant increase in the number of people, what one person, and one infected person can infect with this variant. The final or another key factor to this virus is that the incubation period of this virus is actually shorter by a couple of days when compared to the other variants. Therefore, that there is a less time between infection and the development of symptoms, and therefore shedding virus. So those who get infected will take less time for the virus to start shedding compared to other variants. Now, there's a lot of questions surrounding the effect of vaccinations and if our currently available vaccines have activity against this variant. As John has mentioned, yes, that this variant, that all the currently available vaccine has activity against all the variants, including the Delta variant. One thing I do want to point out is, for those who have received the mRNA COVID-19 vaccine, that the immunity that's developed after one dose against the Delta variant is lower than that compared to other variants. But when those who have received the second dose, the level of immunity significantly increases to match that of all the other variants. In other words, if you have only received one dose, I strongly encourage you to get the second dose, to complete your vaccination series, therefore to get the maximal protection against this variant. Now, there's other questions about whether previous immunity from this from COVID-19 would it infer or incur immunity against this variant. And the data have shown that in general that there are some that protection that previous infection with COVID-19 would provide protection, at least up to 90 days. And that reinfection during that period, between the 90-day period, it seems to be very uncommon or rare. However, beyond the 90-day period, it seems to drop. And certainly that is more, and that's, would be the case if we're being infected by the same variant. But in this case, there's data still out whether or not that, infection with previous infection with other variants don't necessarily guarantee protection against the Delta variants. So therefore, again, if you have been infected, have had COVID-19 in the past, and you have not been vaccinated, I strongly encourage you to get vaccinated to help to gain, again, maximal protection against this variant. Now, breakthrough infections are expected, as John and Dr. Bush had pointed out, but they are rare. And most of those who have breakthrough infection, the symptoms are fairly mild. Now, one of the major advantages of vaccination is that if if it happens that you do have someone develops breakthrough infection, the duration of symptoms and the infectivity or shedding of the virus seem to be much shorter in those who are vaccinated compared to those who are unvaccinated. And finally, the activities of the currently available monoclonal antibodies, two of them, the Regen-COVID and the sotrovimab, are and seems to be intact. So I know that the FDA has recently approved post-exposure prophylaxis with the Regen-COVID monoclonal antibody. So if you're at high risk for developing severe illness, and your provider could help you determine that, you may be eligible to get the monoclonal antibody to help prevent developing severe illness. Again, vaccination provides much better protection. We rather prevent it from getting infected than waiting for infection to occur and then try to have monoclonal antibody to prevent the development of severe illness. The last point I wanted to make is that all this discussion about the development of variants. And a lot of these variants are the results of mutations in this virus. As you know, ever since this was first characterized this virus back in January 2020, this virus has mutated hundreds of thousands of times. Majority of the mutations incur no consequences, doesn't do anything. Some mutations will result in a detriment to the virus so that it makes them less likely to be infectious or propagate. But every once in a while, a mutation will result in some advantage that to the virus in causing either infection or severe illness, avoiding the detection of the virus by our tests, and probably the biggest fear is to be resistant to some of the treatments we have available. Now, the other point is that in order for viruses to mutate, they have to infect a person or cell. So the active mutation occurs only in those who are infected or infected cells. Therefore, the key to prevent from further mutations, or at least slow it down to occur, is by trying to prevent from getting infected, either by wearing a face mask to prevent from getting contact with the virus, or through vaccination. Now, this virus, the Delta variant, has three key mutations that's a little unique compared to all other variants. There are the L452R, T478K, and P681R. And they're all on the S gene domain. And what that means is that the spike protein, which is the protein on the virus that attaches to the receptor that leads to infection, is different than all the other variants, as well as the original domain, original virus. And this is what makes this virus such a big concern, and why it is it became a rapid spreader in a short period of time. So to prevent, and as I mentioned, mutations will continue as long as this virus has the ability to infect cells and infections. And usually they will occur, and what we're seeing is that they're occurring in large populations of infected individuals who, because there's insufficient percentage of the population that's immune. So until the majority of the population is adequately protected through immunity, face masks will serve as the best protection to prevent further infections. Thank you. I will now pass it to John.
Thank you, Drs. Bush and Koo. We are indeed fortunate in our community to have such a large cadre of skilled and compassionate physicians and other medical care providers. We should never take that for granted. Before I have some closing comments, we'd like to open this up for questions from the media. Please indicate to whom you'd like your question directed. So, any questions out there? Mitch, go ahead.
This one's for you, John. With the statewide state of emergency now lifted as well, Billings' state of emergency now lifted, what's the trigger point to recommend to local governments that you want masks to be worn across businesses? And how quickly could that happen? I know that things have to be worked through the local governments now.
Right. with the changes in the legislature, the ability of local health officers and local boards of health to take definitive action has been reduced dramatically. And it does require that local governments actually make the decisions. Public health can make recommendations. We are still working through how that's going to happen in our community. It's a little more complicated here because our health department is created by an agreement between Yellowstone County, the City of Billings, the City of Laurel, and the Town of Broadview. So we need to work through with those local governments exactly what the process is going to be. In terms of triggers, at this point, we are a ways from making any sort of recommendation for community-wide imposed restrictions. We're kind of at the front end of this thing. We've seen this before, and we know what it takes to slow it down. What it takes to slow it down is for people to get vaccinated, for people to, when they're out in public places, particularly in compressed public places indoors, to wear masks, to stay home if you're sick, to make sure your hands are clean and your surfaces are clean. We can all do that right now. We don't need to have that imposed on us. We can all make that decision and slow this thing down.
John, school starts in 3 weeks. Presently, School District 2 is not requiring masks. Is the Board of Health going to give any recommendations to the school districts?
I'm actually meeting with the school board at their meeting, which I think is the third Monday. We'll see what our situation is at that point. Again, this changes very rapidly, and so I have met with the school superintendents over the course of the summer. They've been very engaged all summer long, developing their plans. It becomes a fairly complicated calculus, quite frankly. There's a public health component. There is a pedagogic component. How do we create the most effective learning environment for our kids? And there's a parental choice and preference component. So at this point, we continue to provide the school districts with the data, and particularly paying attention to the proportion of cases that are in people aged 19 and younger. And right now, over the course of last school year, that ran 12 to 15%. I told you that many times. 12 to 15% was pretty standard. The last several weeks, we've been running about 20% of cases are in Yellowstone County are in people aged 19 and younger. So we'll see where the data takes us in a couple of weeks when I meet with the school board. Other questions? Any questions? Let's go to the phone. Any questions on the phone?
Hi all, this is Catherine Houghton, Montana-based correspondent with Kaiser Health News. Thanks for the time. This question would go to Dr. Bush. Doctor, you had talked about staffing issues driven by high volumes and capacity. I'm wondering if you're once again seeing staffers out either because they've contracted COVID or COVID-related quarantines.
So we are seeing a very small increase in that, working at the things that we know that will help us manage that, but that's not been the largest part or even a significant part in any way of the staffing challenges that we're facing. It really is that we've been working our healthcare providers hard for a long period of time through our surge last fall. Then as we came out of that surge and the backlog of cases and things started coming in. And then this time around, as opposed to last year where the surges occurred around the country kind of in stepwise fashion. So this year we're competing for staffing resources with the entire nation, whereas last year we were able to move resources around the country to help.
Makes sense, thank you. And just one quick follow-up question if I can. Do you know what percentage of staffers are vaccinated with the COVID vaccine?
We're up about 60%, close to 60% or a little bit over. And if you take the people that have medical reasons for not being vaccinated, we're getting closer to 70. So.
Got it, thank you.
Any other questions from anybody? All right, I just have a couple closing comments. Our top line message today is simple and to the point. Please get vaccinated. If you or your family members aged 12 and older aren't yet vaccinated, talk to your healthcare provider about any questions or concerns you might have. Free vaccines are readily available at local pharmacies and pediatric clinics, and Riverstone Health is offering free vaccines at walk-in clinics and by appointment in our immunizations clinic. Please check covid.riverstonehealth.org for a list of upcoming free vaccination opportunities. Billings Clinic, St. Vincent Healthcare, and Riverstone Health have organized community clinics that vaccinated thousands of people a week at Metro Park and the Shrine Auditorium until demand declined. Since May, Riverstone Health outreach clinics have vaccinated more than 1,100 people all over our county at schools, churches, parks, public events, and businesses. Our Healthcare for the Homeless clinics have vaccinated more than 100 people who are experiencing homelessness. And our home health nurses have vaccinated more than 120 homebound people. COVID-19 infections are not trending in the right direction, but we have an opportunity to change that through vaccination. About 47% of Yellowstone County residents aged 12 and older have been fully vaccinated against COVID-19. That is 63,700 of us vaccinated, but we still have 71,000 unvaccinated neighbors who are eligible for this safe, effective, and free vaccine. And let's not forget that some of our youngest citizens, some 25,000 children who are going back to school in 3 weeks, are not yet eligible for vaccination and can both contract and spread COVID-19. Please do your part to help end the COVID-19 pandemic and get your vaccination. Finally, with regard to testing, people who think they might have been infected with COVID-19 or were exposed to an infected person can get a free test at Riverstone Health's main clinic at 123 South 27th Street. Testing is by appointment only, Monday through Friday from 8 a.m. to 12 p.m. To schedule an appointment for this free testing, please call 406-247-3350. Again, if you'd like to get free testing at Riverstone Health Clinic, 406-247-3350, Monday through Friday, 8 a.m. to 12 p.m. I'd like to thank again Drs. Koo and Bush for joining me today, and thank you all for coming. Please be safe.
Sorry, quick question for you. We've had people reach out to us about scheduling a COVID test anywhere. Are you going to be increasing your testing capacity with an uptick in cases?
We are looking at what to do with testing capacity. I know the hospitals also have testing capacity that they can work through. Would you like to explain where your tests are available?
So we do have testing available through our walk-in clinics. If you're ill enough to require the emergency department, any of our primary care practices do have testing available to them. So
as for Billings Clinic, where for an outpatient setting, our primary testing site is the viral same-day care on our main campus. So we do have I have some limited testing capacity in many of our outlying clinics, and certainly we have testing in our emergency department if that becomes necessary. So.
All right. Thank you all. We are concluded.
All right, now we were just hearing from the Yellowstone County Health Officer, John Felton, speaking for about a half hour, also with Dr. Neil Koo from Billings Clinic and Dr. Michael Bush from St. Vincent Healthcare. We haven't heard one of these in a while. We haven't actually had a presser in a while. And so the big thing here is obviously a spike in cases due to the Delta variant. So let's just break down a little bit about what was said as they were talking about this. We have seen a spike in cases throughout Montana and especially in Yellowstone County. Yellowstone County now is the second in active cases behind Flathead County when it comes to the most active cases in the state. Death toll now sitting at over 1,700. Of course, this is because of that Delta variant. Dr. Neil Koo from Billings Clinic telling us that the Delta variant's incubation period is quicker now, but the vaccination does offer that full protection against all of the variants that we do see that are out right now against COVID-19. Again, all three of these health officials are pushing the vaccine into the community, saying that there's still about 70,000 Yellowstone County residents who are not vaccinated. Here's what we know so far. Infections are occurring in large groups. And we know this also from reporting it recently that we're going to be heading back to school soon. Students are going to be heading back to school. School District 2 is not requiring masks, but they are encouraging them. 50% of confirmed cases in Yellowstone County now have more than any other county. So Yellowstone County is really hopping up there when it comes to new cases and active cases. So that's something that our health officials and the Unified Health Command is really watching right now. 1,300 people have been hospitalized since the pandemic started, and of those, about 13% were fully vaccinated. Of that, 4% fully vaccinated people have died. St. Vincent Healthcare and Dr. Michael Bush talking a little bit about how they're dealing and how the hospitals are dealing with this surge in cases, saying 16 patients right now they have in their hospital that are infected with COVID. And there are some concerns about managing these new spikes in cases and how healthcare officials are going to kind of manage that. And they expect that to also increase in the coming weeks. And they also mentioned that 60% of their staffers are fully vaccinated. A lot of information is coming out because we are hearing this for the first time in kind of a while, and all of it is because of that Delta variant, which health officials say is much more contagious, can spread a lot quicker than we've seen in the past. So they're really starting to kind of ramp up their message about vaccinating and talking about free clinics that you can get, free testing that you can get when it comes to vaccination. We did have our Mitch Legge at that press conference, and he is going to be talking a lot about that coming up tonight on the 5:30 news. So we hope that you join us for that, and we will have a complete rundown at ktvq.com. We'll see you a little bit later.